Hospitals across Texas are enforcing a new rule. Certain providers will now be asking patients what their immigration status is. Lilybeth Vias joins us in the studio. Lilybeth, what does this mean for potential patients?
Crystal, the new rule applies to hospitals who are enrolled in Medicaid or the Children's Health Insurance Program, also known as CHIP. Patients seeking care from these providers can expect to be asked what their legal status is during the intake process. This is all part of an executive order Governor Greg Abbott signed back in August, but it took effect starting just a few days ago on November 1st. The order also demands hospitals to report the number of undocumented people who received care and the total cost of the care they received. Governor Greg Abbott says he is seeking reimbursement from the federal government for the health care costs of people who are not lawfully in the U.S. Some argue this order might deter people from seeking the care they need.
Well, they shouldn't be denied any type of health care at all for refusing to answer that question. Based on the executive order, the hospital or provider, healthcare provider is still required to provide that service.
Meanwhile, a spokesperson with the Texas Hospital Association, which represents 85% of the state's acute care hospitals and healthcare system, says the bottom line for patients is that this doesn't change the hospital care. Texas hospitals continue to be a safe place for needed care. On the particulars of implementation, all hospitals are different across the state, and they are working on the back end to determine how to comply with the reporting guidance and meet the state's deadlines. Reports from the hospitals will be completed every month. They're expected to be sent in on a quarterly basis starting March of next year.